So what would you share with those listeners of any practical tips to advocate for themselves to get access to this information?
I think the three things to remember is one, know your personal health history and your family history if you're able to. There's some folks, that are adopted or they may not be able to know it, and that's okay. Again, that's something you can talk about with your provider, your genetic counselor about what that means, what your concerns are. If you do notice that there's a pattern and several people in your family have diabetes or have developmental delay, talk to your provider, talk to a genetic counselor. The second is think about family and personal history. Two, find a geneticcounselor.org. So there is a website where you can go in and you can find genetic counselors. They are not just in large academic medical centers. There's a lot of telehealth options available as well. So you can find some there. And sometimes, you can talk to your doctor. They might order the test and then refer you to a genetic counselor. So there's not necessarily one way to see a genetic counselor. Probably the third thing is to remember that genetics is just a part of your health. It's not your destiny. It's not a crystal ball. It's not necessarily going to tell us everything that's ever going to happen or encounter. But it does, I've heard somebody describe it like a flashlight, like it's helping us shine a light on certain things, understand certain risks, understand if there are different directions we should be taking, but it's not always the whole picture. So if cancer runs in your family and you don't do genetic testing or genetic testing doesn't find anything, you still want to make sure that you're thinking about healthy habits, talking to your physician about what are some other ways that you can either find cancer early or reduce that risk. Are there any research studies potentially available that you might qualify for? So just remember that genetics gives us pieces of information, but again, it may not always tell the whole story. And that's why it's important to work with people that have a background in genetics, because not only do they know what the benefits are, they know the limitations and how far that knowledge extends.